Good day, students. Today we will discuss problems of discipline modern teeth whitening methods. Theme: reasons of change of color of hard tissue of teeth. The history of the development of teeth whitening methods. Lecture: Makusheva Natalia Vячеславовна, Department of Pediatric Dentistry and Orthodontics. Objective: to study the history of the development of teeth whitening methods, the causes of discoloration of hard tissue of teeth. Lecture questions: the history of the development of vital bleaching methods, the history of the development of laser teeth whitening, the history of the development of pulped teeth, reasons for discoloration of hard dental tissues, fluorosis as a result of dental pathologies, age-related changes, etc. Discoloration: a change in the color of the coronal part of the tooth. The term was introduced into Russia lecture by Professor Groshikov. Discoloration are, at different ages, in temporary and permanent teeth. Suffers from discoloration is 31% of men and 21% of women. Discoloration of teeth is a common problem. Relevance: in recent years, the aesthetic requirements of patients for dental treatment have increased significantly. Patients are increased in a treatment that eliminates defects and eliminates lost function and meets their aesthetic ideas. Beautiful teeth in our society are becoming one of the indicators of a high quality of life. New technologies of whitening occupy an important place in the complex of the treatment measures and make it possible to achieve an improvement in aesthetic quickly and easily. History. Most doctors preferred to use traditional methods for treatment, such as prosthetic with artificial crowns. By the mid-17th of the last century, the opinion of doctors began to change, especially after achieving positive results in whitening teeth with tetracycline pigmentation in children. By the mid-17th of the last century, the opinion of doctors began to change, especially after achieving positive results in whitening teeth with tetracycline pigmentation in children. At this stage of development, the popularity of teeth whitening methods among doctors have increased significantly, but at that time whitening was widely used in their practice by a rather narrow circle of specialists. Today, in North America, 90% of dentists offer their patients some form of teeth whitening. The first attempts to whiten teeth were made over 200 years ago. However, as evidenced by historical data, methods of teeth whitening were used in Rome in the 1st century AD. For clarification, wine vinegar, oxalac, and hydrochloric acid were used. In 1877, Dr. Chappell described the oxalic acid bleaching methods. In 1884, Dr. Harlan published the bleaching technique using hydrogen peroxide, which he called hydrogen dioxide. In 1980, Abbott, using superoxole and hot radiation, discovered the basic principle of the whitening process still in use today. High-intensity light radiation causes a rapid rise in temperature in the hydrogen peroxide solution, which leads to an acceleration of the chemical bleaching process. After that, all the efforts of the sciences were aimed at creating more effective bleaching system, catalyzing equipment in the form of sources of light and heat energy. A significant step in the development of teeth whitening methods was the use of medical lasers of catalysts for the chemical oxidation reaction. In the early 19th, ILT developed a laser teeth whitening technique using an argon laser and a CO2 laser. Further development of methods of laser teeth whitening led to the emergence of modern chemical whitening system, the popularity of which is growing every day. The next significant step in the development of the teeth whitening was the emergence of the home method using carbamide peroxide gels. These methods were widely used by doctors in the 18th of the last century. The development of these methods of whitening followed the path of creating the most optimal gel concentration and reducing the time of wearing the matrix with the gel. In crown or internal whitening. Dental whitening has a history of development. The first case of whitening of pulped teeth with chloride was described by Dr. Gairston in 1895. After that, several more doctors repeated this whitening procedure, but the result in all cases left much to be desired. In 1958, Pearson proposed using a pulp chamber in which he placed a cotton ball soaked in superoxole for 3 days. In the late 1960s, Nutting and Poe proposed a standard procedure for whitening pulp teeth in which 30% hydroxide peroxide mixed with sodium perborate was placed in a pulp chamber for up to 1 week. This technique is called the on-the-fly combination whitening technique. In crown or internal whitening. Dental whitening has a history of development. The first case of whitening of pulped teeth with chloride was described by Dr. Gairston in 1895. After that, Several more doctors repeated this whitening procedure, but the result in all cases left much to be desired. The inside-outside technique. 1997 Settembrini and 1998 Carillo involves the use of 10% carbamide peroxide in the mouth guard and in the tooth cavity together. Forced office whitening. The first attempt of office bleaching was made in 1980, when Abbott discovered the high-intensity light caused a sharp rise in temperature with a consequent increase in the effectiveness of bleaching reaction. A new era in whitening history began in 1989 with research by Haywood and Heyman, who substantiated the effectiveness of vital whitening by applying a stabilized solution of carbamide peroxide in a mouth dry. Tooth color. The color of intact teeth is mainly determined by dentin and varies depending on colors of the enamel covering the crown, transparency of enamel varying with the degree of calcification, enamel thickness that is greater in the occlusal incisal areas and thinner in the cervical third. Color has three dimensions: hue, saturation, and brightness. Hue or tone is a pigment, or what is more commonly referred to as color. Saturation is the concentration of hue, or the degree of color density. Brightness is the relative whiteness or blackness of a color and the phenomenon of a qualitative assessment of the gray component of a color. Causes of tooth discoloration. The first one, congenital disorders of the color and transparency of tooth tissue. For example, hypoplasia, fluorosis, tetracycline teeth. Second, age-related changes in color and transparency. Third, change in color and transparency of tissues as a result of carious lesions. Four, discoloration due to staining of dentin with pigments. Staining of exposed dentin from the side of the oral cavity. Staining of dentin from the pulp chamber. 5. Surface painting. Pigment plaque from food days, tea, coffee, red wine, apple juice. Smoker's plaque. Staining associated with drugs, chlorhexidine, antibiotics. Black plaque associated with the presence of certain types of microorganisms in the oral cavity, and tartar. Causes of tooth discoloration may be as congenital disorders of color and transparency. For example, fluorosis of permanent teeth is a disease causing enamel structure and color change. Also, congenital disorders of color and transparency is amelogenesis imperfecta, a congenital malformation of hard dental tissue. You see this discoloration on the photo. Next congenital disorder of color and transparency is tetracycline lesion. You see tetracycline teeth on the photo. Tetracycline is broad-spectrum antibiotic effective against gram-negative and gram-positive bacteria. Taking tetracycline during odontogenesis causes a noticeable pigmentation of temporary and permanent teeth. The color changes depend on the type of tetracycline used. It may be gray-brown, yellow, or black. Pigmentation occurs in dentin due to the chelation of the tetracycline molecule with the calcium ions of the hydroxyapatite crystals. The chelated molecule delivers dentin-predentin to the point of mineralization via the terminal pulp capillaries. Pigmentation can be classified according to the developmental stage, streaking and color. Grade 1. Weak tetracycline pigmentation from gray to yellow. Pigmentation evenly spread over the tooth, no stripes. Grade 2. Moderate pigmentation from yellow-brown to dark gray. You see this pigmentation on the photo. Grade 3. Significant pigmentation. Blush gray or black pigmentation accompanied by significant streak across the teeth. Grade 4. Resistant to pigmentation is suggested to indicate so dark pigments for which whitening was not effective. The severity of pigmentation depends on three factors: time and duration of admission, tetracycline type, and doses of tetracycline. Localization of the stained areas of the tooth is associated with the period of odontogenesis, during which tetracycline is taken. Localization and time of taking tetracycline. Localization. Staining of temporary anterior teeth in the incisal area. Time of taking tetracycline is tetracycline treatment of a pregnant woman. Localization. Staining of the cervical area of the crowns of the interior teeth and the chewing surface of molars is taken tetracycline by a child in the first month of life. Localization. Staining of temporary molars and first permanent molars. Taken tetracycline for a 6-month-old child. Staining of the anterior permanent teeth in the cervical region. Taken tetracycline for a child aged 2-3 years. Staining of crowns of premolars and second permanent molar. Tetracycline intake by a 4-year-old child. On this slide, you see the difference between tetracycline lesions and age-related changes in dental tissue. On the first photo is tetracycline lesions. You see the stripes. Age-related changes in color and transparency. With age, the following transformations are observed: enamel changes, texture changes, and thinning. It may be dentin deposits, secondary and tertiary denticles, changes in the composition of salvia, changing the consistency and composition of salvia. Age-related thinning of the enamel leads to a change in appearance. Dark sad crowns. Microcracks and defects of the enamel surface allow external chromophores to penetrate into the enamel, causing internal staining. Restoration materials and dental procedures as causes of dental discoloration. For example, eugenol causes orange-yellow pigmentation. You see it on the photo. Orange-yellow teeth. The next causes is endodontic material. Silver post, for example, can cause gray discoloration. Endodontic materials contain silver, cause darkening of the crown. You see it on photo. Darkening color of teeth, of tooth. Next type of causes of discoloration is silver amalgams, which can give the tooth of grayish color due to the penetration of silver salts into the dental tubulus. Next causes of dental discolorates is leakage of composite restoration, which can cause yellowish discoloration of the tooth. You see on the photo the bad restoration. Resorcin formalin paste causes red-brown staining. You see the teeth which colored in red-brown. This is resorcin formalin paste. Mechanism that cause pigmentation of the pulped teeth. The first one is degradation of tissue during the necrotic process. Next one is rupture of blood vessels due to trauma with hemolysis of erythrocytes and the release of derivatives of hemoglobin and hematine. Erythrocycline can penetrate into the dental tubulus. Pigmentation can also be triggered by uncontrolled bleeding during endodontic manipulations. The next one is intracanal administration of drugs containing phenols and iodoform. Causes gradual pigmentation as a result of their penetration into dentin and subsequent oxidation. Violation of the tightness of the crown restoration is the next one cause or mechanism that cause pigmentation of the pulp teeth. And more several mechanisms is inadequate access to the root channel through the crown, leaving residual pulp and necrotic tissue in the tooth cavity. Next, contamination of the tooth cavity during endodontic procedures. Next, insufficient washing and cleaning of the wound. Oxidation of silver posts in the root channel. Color change during functions. The first one is erosion. Is the progressive loss of hard tooth tissue under the influence of chemical process that are not consequence of bacterial activity. This dissolution of the enamel with acids causes staining of the teeth, as dentin is more yellow than enamel. You see the erosion of the teeth on the photo. Next one, teeth abrasion can darken teeth due to reduced surface area. We have no enamel and we see dentin, and dentin is more yellow, so we see yellow teeth. Abrasion of occlusal of proximal surface causes by chewing or occlusal contact. Chewing and cutting surface are affected. The next type of abrasion is wear and tear of hard tooth tissue or restoration material, not caused by the impact of dental contact. Usually, this is chewing a pipe, hairpins, or playing a musical instrument, often caused by brushing your teeth too vigorously. The loss of enamel imparts a yellowish color to the tooth due to the underlying dentin. Chemical causes of dental color changes. Rinses, toothpastes contain chlorhexidine, cause superficial black or brown pigmentation. The next one, metals. Copper, nickel, iron leads to the formation of green plaque on the teeth of industrial workers, staying plaque around metal orthodontics braces. Next one, iron preparation from black plaque on teeth and tongue. Conclusion. It is necessary to carefully find out by questioning the patient the etiology of staining before starting the bleaching procedure. In some cases, pigmentation is based on multifunctional components due to the accumulation of chromogens and food pigments over many years. Thank you for the attention. You can see this presentation at PDF and I send it to you, and you will write if you lost something. Goodbye.